Sickle cell anemia, forgotten, but not gone. It affects 90,000 to 100,000 Americans.
Sickle cell disease is a global problem affecting children, adults, families in the United States and all over the world.
But where did this disease come from? Could it be that the sickle cell trait was created in people in countries like Africa, South and Central America, and Mediterranean countries to protect their bodies against another disease? Dr. Wanda Sherney.
You know, if you look at the distribution of malaria in the world and you look at the distribution of sickle cell, you're going to see that the two are amazingly similar. And that's because having sickle cell trait actually protects you from malaria. Now, if you have sickle cell disease, you're less likely to get malaria, but if you get it, you're more likely to die from it. But if you have sickle cell trait, not only are you less likely to get it, but if you get it, you're less likely to die from it. So there's a selective advantage of having sickle cell trait when you live in a place where malaria is a problem.
In the United States, about 1 in every 500 African Americans are born with the disease. But how did it get here?
And when I talk about the distribution of sickle cell disease being similar to that of malaria, you might ask, well, there's no malaria in the United States, but we certainly have sickle cell disease, and that's as the result of migration. And that particular migration was the slave trade. So when we were brought here to build this country, then we brought our sickle cell genes with us.
People who inherit a sickle cell gene from one parent and a normal hemoglobin gene from the other parent have a condition called sickle cell trait. Sickle cell trait is different from sickle cell disease. People who have the sickle cell trait don't have the disease, but they have one of the genes that cause it. Like people who have sickle cell disease, people who have sickle cell trait can pass the gene on to their children. Kelly and Amy get married, but never discuss whether or not either one of them have the sickle cell trait.
But I didn't actually know that I was a trait. And I definitely didn't know that Kelly was a trait.
Every baby born in the state of Michigan, every baby born in the country is tested for sickle cell disease at birth. And here in Michigan, at least in the Detroit metropolitan area, I'm the person that calls the couple to tell them that their baby, who was just born maybe 2 weeks ago, has sickle cell disease. And one of the things I've learned from 27 years of doing that is that the way a lot of young black men find out they have sickle cell trait is when they have a baby with sickle cell disease.
No, I never asked her whether or not she had a trait, actually I kind of forgot that I had the trait. Because it was so long ago.
Two carriers have a 25% chance of having an unaffected child with normal hemoglobin, a 50% chance of having a child who also is a carrier, and a 25% chance of having a child with sickle cell anemia. Their child, Alan, is born with sickle cell.
When both parents learn that they have sickle cell trait, it's not necessarily the case that they're going to decide not to have children. Or if they have an affected infant or fetus, that they're going to have prenatal diagnosis, and when they find out the child has sickle cell disease, they're going to abort that fetus. And that's not what the Sickle Cell Disease Association is all about. We're about helping parents to make informed decisions about childbearing.
Tamiko and Keith McKenzie both knew that they had the trait, but they decided to take the chance to have a baby.
Yeah, we knew. That's the part that I always feel guilty about, because I knew that I had the trait, and I knew we had just got retested just to confirm that we both had the trait. And during that time I was having issues, and I was seeing her a reproductive doctor, and when she fixed that issue, we were about to discuss, our options for having a child with our trait. So, when we were getting our, he was getting tested and I was getting tested, and spontaneously we conceived. So once we conceived, it was just like, we didn't want to, we didn't know. We were so excited that, wow, I was able to conceive. And so we just felt like, we were going to just, pray and hope for the best. And then we got counseling, and they told us that in each pregnancy, it's a 1 in 4 chance for your child to have sickle cell. So we said, well, we have a 1 in 4 chance. Maybe he'll just have a trait.
Yeah.
And so that's what we,
just rolled the dice. It was a 25% chance that our son was going to be born with the disease. And, I guess you could say we lost, but, he's born with it. And I think when we talk about other kids that experience a lot more sickness than he does, I think he's doing well with it.
I knew from my first prenatal visits, when I was pregnant the first time with my son, that I had a sickle cell trait. But that was the first time that I had ever in my life heard about a sickle cell trait. I didn't know what that meant. I just knew that sickle cell was something bad. I knew that much. As an artist and looking at other artists, I had seen people like T-Boz and, hear them say that, they had sickle cell and heard about her bouts with the disease. So I was like, oh God, I got a trait? So what does that mean?
If there were some symptoms of sickle cell trait, if it turned your eyes green, if it did, your fingernails turn purple, then you would know, or you'd be going to the doctor, do I have sickle cell trait? Is that what's causing me a problem? Because it's a trait. It's a carrier state. You don't know that you have it unless you have a very specific test.
So I had a trait, my husband had a trait. So that meant that any child that would come out of that union had a 25% chance of having the full-blown sickle cell disease. So I knew that going in. So when I had my son and he was born and he fell into that 25% that had nothing. So he didn't have the trait, he didn't have the disease, he was a little premature, but other than that, he was fine. As for whatever reason, tragic accident, I lost my son and got pregnant right away again. Husband and I got pregnant again. So I went into this pregnancy with my daughter kind of knowing, what it was, but I felt so confident, that, God wouldn't take my son, who was perfectly healthy, and then give me a daughter that would have sickle cell disease. Oh, God's not going to do that. Oh, he's more merciful than that. So I kind of went into the pregnancy, with this hopeful expectancy that she would be fine too.
So when he was an infant, what he does is that his crises would start as to a fever, or his hands would swell, or his feet would swell. And that's when we knew that he would be having a pain crisis.
Through the years, Alan's pain crises have gotten progressively worse. He's now 10 years old, and Kelly, a single parent, finds it emotionally challenging to deal with the sickle cell bouts.
Nights in ICU with him, it was really heart-wrenching to just sit in there and just, thinking that, they may have to drain his lungs to get the fluid out and things of that nature. So, okay.
Sorry to wake you up, okay?
All right, sir.
All right.
Make sure you say your prayer, okay? I'm looking at him, and I got to try to stay strong for him. So, it tears me up on the inside, and sometimes I just have to get out the room and break down based on, what he's going through.
I think one of the most common things about sickle cell disease is it has very unrelenting pain a lot of times, and the pain is not seen by people who observe it, but it's nonetheless there and it's very real. And the other problem about the pain is that it occurs very suddenly without forewarning, and it can last in different amounts of time. And people, because they don't see it, it's not like cancer where you see something, they tend to be ignored. They tend to be ignored, and they tend to be sometimes misbelieved.
Keith is 4 years old, and his sickle cell is not as severe as Alan's, but he makes regular visits to Children's Hospital for blood transfusions.
Up until age 4, from 2 to 3 years old, we only had to deal with reoccurring fevers. So he would have to be hospitalized anytime his fever was over 101. We would have to take him straight to emergency room. And it seemed like it was a pattern, like every growth spurt or whatever, or every 3 months, I felt like we were at the emergency room with this fever, and we would have to stay for 4 days. At least up to 4 days, because they have to, you have to do the 48 hours for the blood cultures. And we always looked out. It was never any bacterial or any, viruses or anything. This is the first year that we've actually really had to face, the real issues of sickle cell.
Do people with sickle cell disease sometimes require a blood transfusion? Yes, sometimes they do. And with sickle cell disease, this variability is much more extreme than in most other illnesses. There's some people that do very well, and there's some people that are very sick. So that's the long answer to the fact that, yes, sometimes people with sickle cell disease need a blood transfusion. The most common type of sickle cell disease, the SS type, is actually called sickle cell anemia. So there you go, anemia, low hemoglobin, low blood count, maybe you might need a blood transfusion.
The test basically indicated that his blood vessels in his brain on one side seems to have like sticky blood, so it wasn't flowing properly. The sound waves were off, and basically that makes him
more susceptible for strokes.
Yeah, for strokes. That means that he can have a stroke at any moment between now and in the future.
I'll never forget the day I got the call. I'll never forget that day. My daughter was about 2 months old. I was holding her in my arms, and my husband answered the home phone, and it was Dr. Wanda Sherney from the Sickle Cell Clinic at Children's Hospital. And I promise you, my heart just stopped, because I'm like, wait a minute, why is anybody calling me from the Sickle Cell Clinic down at Children's? And I got on the phone, and she proceeded to tell me about what I needed to do, things I need to look for, like temperatures and pain crisis and statistics about children with sickle cell, and it was just overwhelming. She talked about, the possibility of strokes and the possibility of this, and I can just remember, Kirk Franklin, I was playing his CD, and I was holding my baby, and I was just crying profusely, because, I kept hearing Dr. Sherney say, Mom, it's going to be okay. Mom, but we need you to come in. And I can remember myself getting angry and saying, maybe I was in denial, maybe that was my coping mechanism, not sure. But I can remember me just saying, my daughter doesn't have sickle cell, you've made a mistake, and I dare you call my house, you don't even know me. And for 2 years, I avoided the sickle cell clinic, and I avoided Dr. Sherney, and I avoided it completely.
Every child born in the United States now gets screened for sickle cell regardless of race or country of origin. And as soon as they're found out to have it, if they have the trait, they get informed through their physician's office. If they have the disease, they are referred to a center like ours, where an expert in sickle cell disease can do counseling about the disease condition, about what to watch for, what kind of care to seek out, so that you can have access to the care that your child needs. That's the most important thing, is having access to the care that your child needs.
When she had the first crisis, it was like, I was devastated. She had sepsis in her blood, which is a blood infection. She had like maybe 106 fever for about 2 weeks. She was in the hospital for about 4 weeks. And it was just a roller coaster ride. She was in agonizing pain, screaming, on morphine. Nothing could console her. And a lot of times children with sickle cell, their veins, because their blood is sickling, their veins collapse. And so I can remember her being in the hospital maybe that third week, and they were trying to draw more blood to see what was happening with the infection, and they couldn't get a vein. And I can remember them coming in saying, "We're going to have to shave her head. We have to shave the baby's head because we can't. All her veins have collapsed." And I can remember falling on the floor of that hospital room. And I said, "God, you got to do something. I cannot have them shaving my little baby's head. I can't. You have to do something." And a very, very special nurse came from the trauma unit. I guess maybe they had called. She had heard what was going on. And she came and she looked all around and she found a vein in the top of my daughter's foot. And she said, "Here, we can get some blood and we won't have to shave her head."
Early diagnosis of sickle cell disease is very important so that the children who have the condition can get proper treatment. Almost all states in the United States now test newborns for sickle cell disease with a blood test. Anyone can request a sickle cell test. Although a blood test can diagnose sickle cell disease, doctors are not able to predict how seriously the disease will affect individual patients. There's no simple test to identify which patients will have almost normal lifespans, very few painful crises, and little damage to their body due to the sickle cells, and which patients will have frequent painful crises and drastically reduced lifespans. For this reason, deciding on a course of treatment can be very difficult.
I really believe that a part of the problem is that these are very difficult patients to take care of. They change all of a sudden. They have a lot of pain. They're starting to feel the wear and tear all over their bodies of having these blocked blood vessels with these sickle cells, and all of their different organs are being affected. So they're very complicated patients to take care of.
For the next several years, just living in and out of the hospital, it came to a point where they knew me by name. They knew me and my husband. They said, "There's the Rays. Where's Brooklyn? She's on 4 West, or she's on 5 East." Because we were there so much. The fevers, the sepsis, the blood infections, maybe she had a stroke because she had problems walking and her developmental delays were discovered. And they thought she could have had a stroke when she was a baby. And it's a devastating disease, and I think it's one that people, they don't understand. Maybe they've heard about it in passing, but they don't really understand the magnitude and the devastation and all of the other chronic things that come along with it. The children with sickle cell disease are 200 times more likely to have a stroke between the ages of 1 and 5. My daughter has had Kranz Dopplers on her head every year of her life to make sure, that she's not at threat for further strokes.
Between 5 and 10% of children with sickle cell disease will have a stroke. Once you have a stroke, you have a 75% chance of having a second stroke.
And I felt like, was I supposed to walk away from the love of my life because I found out that he had the trait when we were dating? We were just dating. I didn't know that we would become a family. So, we both carried on. When we first met, we just hit it off, and we were like best friends. I had a great relationship, a bond, and I just felt like it was unfair for us not to pursue what we had because, we had his tainted blood.